Are you struggling to sleep while on prednisone? Well, I don't blame you, because prednisone definitely causes insomnia. Hi, I'm Dr. Megan, your prednisone pharmacist, and right now I'm having flashbacks to when I took prednisone and I got such terrible insomnia. The reason I'm awake right now at the wee hours of the morning is because I have a toddler who is not letting me sleep, sick tonight, and so here I am to talk about prednisone causing insomnia. First of all, you might be wondering, does prednisone cause insomnia? And the answer is definitely yes. Is insomnia even a side effect of prednisone? Well, what's crazy is if you look at the package insert, that little patient leaflet they print out at the pharmacy, it doesn't say insomnia on it. But next, it's insane. Like, why is that so insane? Because they did a study of people's tweets about drugs, and they counted every single time somebody mentioned prednisone or prednisolone in a Twitter post. And they found that people commented the most about which side effect? First, insomnia, and second, weight gain from prednisone. People are talking about it all the time, but it's somehow not listed in the package insert. Isn't that wild? What can I do about it, right? So yes, prednisone insomnia is real, but there isn't a lot of great data about it. I have to explain, when does it go away? Well, to answer that, how it causes insomnia first. But let me share with you what we do know about it. And then I can explain more about the timing and how to make it go away. So prednisone, we're taking it as an anti-inflammatory drug, and it's mimicking a naturally occurring hormone in our body called cortisol. Cortisol is amazing, and it keeps us alive during emergencies like famines or war. It's a stress hormone. And if we were in a famine or in a war, we wouldn't want to fall asleep in this stressful time. So cortisol keeps us awake. So it makes sense evolutionarily why our bodies would do this. And how does it keep us awake? There's 3 ways they've proposed in the scientific literature. First, behavior changes through modification of the hypothalamic pituitary adrenal axis, or the HPA axis, the cortisol system. Cortisol, I already covered, that was the first one. That's why we want to stay awake. We don't want to die even though we're so hungry. It's keeping our species alive. So that's the first one. Second, changes in your natural sleep-wake cycle. Normally, cortisol is secreted early in the morning and then it falls off throughout the day. And by the time you fall asleep, it's nearly gone. And at that time, melatonin goes up and then it falls off throughout the night. So that when the cortisol is ready to wake you up, it does. And they're opposite and they balance each other out. But when you take prednisone or dexamethasone or any other steroid, it's messing that cycle up and the melatonin stays low. And so you don't get as much of that vampire hormone, that hormone that helps us get sleep at night. So prednisone is actually depleting melatonin from our bodies. Other hormones that are affected include tryptophan. So tryptophan is that one we always talk about as, the Thanksgiving turkeys making it hard to stay awake after the big feast, because it has tryptophan in it, right? That's an amino acid that causes sleepiness. And another hormone is called orexin. It's affected as well. And finally, number 3 is hyperarousal of the GABA system. So GABA, or gamma-aminobutyric acid, is important in keeping us calm. And if it's out of control, then it's really hard to stay calm. It says they slow the rate of recovery of GABA and inhibit the transmission of GABA. So it's blocking it and slowing it down, slowing the little pump down. So you're not being able to use GABA as well. Other hormones that are affected could include acetylcholine, N-methyl-D-aspartase, or NAMDA, serotonin, DHEA, and allopregnanolone. All of these hormones are being affected by prednisone. So, wow, no wonder prednisone is causing insomnia. And how long do these symptoms last then? If there's that many systems being affected, how long does it last? Well, some of those recover really quick, but some of them don't. And guess what it depends on? It depends on the dose you've been taking, the actual drug you've been taking, whether it's dexamethasone, which is long-acting, or prednisone or hydrocortisone, which are shorter-acting. And the higher the dose, generally the worse the insomnia. And one study they did of methylprednisolone, which is really similar to prednisone, it's also called Medrol. They showed that symptoms of either insomnia or mania developed within 3 days and persisted for the entire 8-day course of therapy. And most people, it recovers after you stop taking it. But for a few people, mania, anxiety, other like jittery feelings don't go away for a while, and you need to get help from your doctor. There are medications they can prescribe that will help you out. You might be wondering, okay, now I know why I'm getting insomnia. Now I know who gets insomnia. It's the people who are taking higher doses. Often at the beginning of therapy, it happens. Even after just one dose, you can get it. That's what happens with dexamethasone. So finally, how to treat prednisone insomnia, or how to deal with prednisone insomnia. Going back to what I covered before, there are hormones that are being changed by prednisone. And so if we can replenish them, then hopefully that makes it so you can sleep better. So the easiest, most simple option to counteract prednisone insomnia is, because the cortisol and melatonin cycle is being interrupted, because the cortisol you're now taking is way up here, then give some melatonin to balance it out, because your body's not able to make melatonin as much anymore when you have such high cortisol. So give melatonin. That's pretty simple, right? There are others in this scientific article that I've been referring to throughout this video. They said that the most important thing is minimizing the dosage and duration. So the lowest number of pills, the lowest amount of time. And then it's usually reversed once we stop taking it. And then they have an acronym called Help Me Sleep, HELPMESLEEP. And I'm just going to read it to you. This is what it says. H stands for herbal tea or warm milk. And this was specifically for people who are in intensive care unit taking steroids in the injectable way. And then, so that was H. E is to evaluate a medication list for causes of insomnia. Like steroids, there are other medications that do too. Limit nighttime interruptions. So for example, not having the lab draws in the middle of the night. Poking somebody for blood, right? P stands for postpone morning laboratory tests. So do the testing in the morning, not in the middle of the night. M is for massage. E is for evaluate daytime activity. S is for sound reduction. L is for light reduction. E is for environment changes. The other E is for easy listening or white sound, and P is for pain relief. So if you can get all that covered, then people are going to feel so much better. You will feel so much better while on prednisone. And if you're wondering a really easy way to get melatonin while you're on prednisone, since I suffered from that prednisone insomnia and it was awful, I came up with Nutranize Zone. It's the first and only supplement for people on prednisone, and it comes in 2 bottles because we want this bedtime one to have the melatonin in it to help you fall asleep. So you can just take this, and not only is melatonin depleted, but there's actually at least 8 other, if not 13 other ingredients in here that we're replenishing that prednisone has stolen. So you can go to Nutranize.com to get Nutranize Zone for people on prednisone. Signing off is Dr. Megan, your prednisone pharmacist.